Question 1. A nurse is caring for a client who is prescribed warfarin. Which of the following laboratory values indicates that the medication is at a therapeutic level? A. INR of 0.8. B. PT of 9 seconds. C. INR of 2.5. D. APTT of 35 seconds. Answer: C. INR of 2.5. This question tests your knowledge of medication effectiveness and laboratory values, specifically for warfarin. The International Normalized Ratio, INR, is the most critical lab value to monitor when a client is on warfarin therapy because it measures the blood's clotting time. A therapeutic INR for most clients on warfarin is typically between 2.0 and 3.0, indicating the medication is effectively preventing blood clots without excessive bleeding risk. An INR of 2.5 falls within this desired range, showing the client's anticoagulation level is appropriate. Remember that warfarin, an anticoagulant, works by prolonging clotting time, and an INR in the therapeutic range confirms its effectiveness. Question 2. A nurse is caring for a client who has a prescription for airborne precautions. Which of the following infections requires the nurse to implement airborne precautions? A. Methicillin-resistant Staphylococcus aureus, MRSA. B. Clostridium difficile, C. diff. C. Tuberculosis, TB. D. Influenza. Answer: C. Tuberculosis, TB. This question focuses on infection control and the appropriate isolation precautions. Airborne precautions are necessary for diseases where pathogens are transmitted through small droplets that can remain suspended in the air over long distances, making them easily inhalable. Tuberculosis, TB, is a classic example of such a disease, requiring clients to be in a negative pressure room and healthcare providers to wear an N95 respirator mask. Understanding the transmission routes helps determine the correct type of precautions to prevent the spread of infection. Always choose the most protective precaution type for highly contagious airborne diseases. Question 3. A nurse is assessing a 4-year-old child admitted with dehydration. Which of the following findings would the nurse expect to observe? A. Bradycardia. B. Sunken fontanelle. C. Increased urine output. D. Decreased capillary refill. Answer: D. Decreased capillary refill. This question assesses your understanding of pediatric assessment and the signs of dehydration in children. Capillary refill time, specifically a prolonged time greater than 2 seconds, is a reliable indicator of dehydration and poor tissue perfusion in children. While a sunken fontanelle might be seen in infants, a 4-year-old's fontanelles are typically closed. Dehydration causes tachycardia, not bradycardia, and leads to decreased, not increased, urine output as the body attempts to conserve fluid. Always prioritize assessment findings that directly reflect hypovolemia in a pediatric client. Question 4. A nurse is preparing to administer an intramuscular injection to an adult client. Which of the following sites is the most appropriate for this injection? A. Deltoid. B. Ventrogluteal. C. Dorsogluteal. D. Vastus lateralis. Answer: B. Ventrogluteal. This question tests your knowledge of safe medication administration, specifically regarding intramuscular injection sites. The ventrogluteal site is the preferred and safest site for intramuscular injections in adults because it is free from major nerves and blood vessels, has a large muscle mass, and is easily accessible. While the deltoid and vastus lateralis can be used, they are generally for smaller volumes or specific situations, and the dorsogluteal site carries a higher risk of sciatic nerve injury, making it less preferred. Always choose the site that maximizes client safety and minimizes complications for intramuscular injections. Question 5. A client is admitted to the emergency department with symptoms of a myocardial infarction. Which of the following actions should the nurse prioritize? A. Administer morphine for pain relief. B. Obtain a 12-lead electrocardiogram, ECG. C. Administer oxygen via nasal cannula. D. Obtain a detailed medical history. Answer: C. Administer oxygen via nasal cannula. This question assesses your ability to prioritize nursing actions during an acute cardiac event. When a client presents with symptoms of a myocardial infarction, the immediate priority is to ensure adequate oxygenation to the heart muscle, which is often ischemic or starved of oxygen. Administering oxygen helps to reduce myocardial oxygen demand and improve tissue perfusion, stabilizing the client's condition before further interventions. While obtaining an ECG, administering pain relief, and gathering history are crucial, improving oxygenation is the initial life-saving priority. Remember the MONA acronym: morphine, oxygen, nitroglycerin, aspirin, but consider the order of critical actions based on immediate physiological need. Question 6. A nurse is caring for a client with a new prescription for continuous enteral feedings via a nasogastric tube. Which of the following actions should the nurse take to prevent aspiration? A. Place the client in a supine position during feeding. B. Check gastric residual volume every 24 hours. C. Elevate the head of the bed to at least 30 to 45 degrees. D. Administer feeding at a rapid rate. Answer: C. Elevate the head of the bed to at least 30 to 45 degrees. This question addresses client safety and proper nursing care for enteral feedings. The primary action to prevent aspiration in a client receiving enteral feedings is to maintain the head of the bed elevated to at least 30 to 45 degrees, which helps gravity keep the feeding in the stomach and reduces the risk of reflux into the esophagus and trachea. A supine position increases aspiration risk. Checking gastric residual every 24 hours is too infrequent for continuous feeding, and a rapid feeding rate can lead to complications like dumping syndrome and aspiration. Always prioritize positioning to prevent aspiration in clients with enteral tubes. Question 7. A nurse is providing discharge teaching to a client with newly diagnosed type 1 diabetes mellitus. Which of the following statements by the client indicates a need for further teaching? A. I should inject insulin into the same spot every time to ensure consistency. B. I need to rotate injection sites within the same general area, like my abdomen. C. I should check my blood sugar levels before meals and at bedtime. D. I will carry a fast-acting carbohydrate with me in case my blood sugar drops. Answer: A. I should inject insulin into the same spot every time to ensure consistency. This question evaluates your understanding of client education for diabetes management, specifically insulin administration. Injecting insulin into the same exact spot repeatedly can lead to lipohypertrophy, which is a localized swelling or thickening of fat tissue that can impair insulin absorption. Clients should rotate injection sites within a specific body area, example abdomen, thigh, to promote consistent absorption and prevent tissue damage. Checking blood sugar regularly and carrying a fast-acting carbohydrate are correct and essential self-management practices. Emphasize site rotation to your clients for optimal insulin absorption and skin health. Question 8. A nurse is assessing a client who has hyperkalemia. Which of the following electrocardiogram, ECG, changes should the nurse expect to observe? A. Tall, peak T waves. B. Flattened T waves. C. Prolonged PR interval. D. ST segment depression. Answer: A. Tall, peak T waves. This question tests your knowledge of fluid and electrolyte imbalances and their cardiac manifestations. Hyperkalemia, an elevated serum potassium level, characteristically causes specific changes on an electrocardiogram, ECG, due to its effect on myocardial depolarization and repolarization. Tall, peak T waves are one of the earliest and most recognizable ECG signs of hyperkalemia, indicating impaired repolarization of the ventricles. Flattened T waves and prominent U waves are more indicative of hypokalemia, while ST segment depression can be seen in myocardial ischemia. Always recognize the critical link between electrolyte imbalances and potential cardiac dysrhythmias. Question 9. A nurse is preparing to administer a blood transfusion. Which of the following actions should the nurse take first? A. Obtain the client's vital signs. B. Prime the foretubing with 0.9% sodium chloride. C. Verify the blood product with another licensed nurse. D. Educate the client about potential transfusion reactions. Answer: C. Verify the blood product with another licensed nurse. This question assesses your prioritization skills and understanding of critical safety measures during blood product administration. The absolute first step, after confirming the prescription, is to verify the blood product with another licensed nurse at the client's bedside to ensure the correct blood is given to the correct client. This two-person verification is a crucial safety measure to prevent potentially fatal transfusion reactions due to misidentification. While obtaining vital signs, priming tubing, and educating the client are all necessary, verifying the blood product is the immediate, non-negotiable step to prevent errors. Question 10. A client with chronic kidney disease is scheduled for hemodialysis. Which of the following dietary restrictions should the nurse reinforce? A. Increased protein intake. B. Increased sodium intake. C. Restricted potassium intake. D. Unlimited fluid intake. Answer: C. Restricted potassium intake. This question evaluates your understanding of dietary management for clients with chronic kidney disease, CKD, undergoing hemodialysis. Clients with CKD often have impaired kidney function, leading to the inability to excrete excess potassium effectively, which can cause dangerous hyperkalemia. Therefore, restricting potassium intake is a critical dietary modification. Protein intake is usually regulated, not increased. Sodium is restricted to manage fluid balance and blood pressure, and fluid intake is strictly limited to prevent fluid overload between dialysis sessions. Always remember that dietary restrictions are key to managing electrolyte imbalances and fluid status in renal clients. Question 11. A nurse is caring for a client with acute respiratory distress syndrome, ARDS. Which of the following ABG results would the nurse expect to see initially? A. Respiratory acidosis. B. Metabolic alkalosis. C. Respiratory alkalosis. D. Metabolic acidosis. Answer: C. Respiratory alkalosis. This question tests your understanding of arterial blood gas, ABG, interpretations in respiratory conditions. In the initial phase of acute respiratory distress syndrome, ARDS, clients often experience hypoxemia and tachypnea, rapid breathing, as the body tries to compensate for poor gas exchange. This increased respiratory rate leads to excessive excretion of carbon dioxide, resulting in a decreased PaCO2 and an initial respiratory alkalosis. As ARDS progresses and lung function worsens, clients may then develop respiratory acidosis due to fatigue and inability to clear carbon dioxide. Remember that initial compensation often leads to alkalosis before decompensation leads to acidosis. Question 12. A nurse is assessing a client who has a deep vein thrombosis, DVT, and is receiving heparin. Which of the following findings would indicate a complication of heparin therapy? A. Platelet count of 350,000/mm superscript 3. B. International Normalized Ratio, INR, of 1.5. C. Red-tinged urine. D. Partial thromboplastin time, APTT, within therapeutic range. Answer, C. Red-tinged urine. This question assesses your knowledge of potential complications associated with anticoagulant therapy, specifically heparin. Heparin's primary action is to prevent clot formation, but its main adverse effect is bleeding. Red-tinged urine, also known as hematuria, is a direct sign of bleeding and indicates that the client may be experiencing excessive anticoagulation or an adverse reaction to the heparin. A platelet count of 350,000/mm superscript 3 is normal, an INR of 1.5 is irrelevant for heparin therapy, it's for warfarin, and an APTT within the therapeutic range suggests effective, not complicated, therapy. Always prioritize signs of bleeding when administering anticoagulants. Question 13. A nurse is providing care for a client with a new colostomy. Which of the following stoma characteristics indicates a healthy stoma? A. Pale and dusky. B. Dark purple. C. Red and moist. D. Dry and retracted. Answer, C. Red and moist. This question tests your ability to assess a new colostomy and identify signs of healthy tissue. A healthy, viable stoma should appear red or pink and moist, similar to the mucous membrane inside the mouth, indicating adequate blood supply and tissue perfusion. A pale, dusky, or dark purple stoma suggests ischemia or poor blood flow, which is a medical emergency. A dry and retracted stoma can also indicate complications or poor healing. Always prioritize assessing the stoma color and moisture to ensure proper healing and blood supply. Question 14. A nurse is caring for a client experiencing an acute asthma exacerbation. Which of the following medications should the nurse administer first? A. Oral prednisone. B. Salmeterol, Ceravent. C. Ipratropium, Atrovent. D. Albuterol, Prevental. Answer, D. Albuterol, Prevental. This question assesses your knowledge of immediate interventions for an acute asthma exacerbation. Albuterol, a short-acting beta agonist, SABA, is the first-line medication for acute asthma attacks because it rapidly relaxes bronchial smooth muscles, leading to quick bronchodilation and relief of airflow obstruction. Oral prednisone is a corticosteroid used for longer-term anti-inflammatory effects. Salmeterol is a long-acting beta agonist, LABA, for maintenance therapy, and ipratropium is an anticholinergic bronchodilator that works slower than SABAs. Always prioritize rapid-acting bronchodilators during an acute respiratory crisis. Question 15. A nurse is preparing to administer medications to a client who has impaired swallowing, dysphagia. Which of the following actions should the nurse take? A. Crush all medications and mix them with applesauce. B. Administer pills one at a time, ensuring the client swallows each. C. Provide a straw for drinking water with the medications. D. Keep the client in a supine position to prevent aspiration. Answer B. Administer pills one at a time, ensuring the client swallows each. This question tests your safe medication administration practices for clients with dysphagia. When a client has difficulty swallowing, it is crucial to administer pills one at a time, allowing them to swallow each dose completely and assessing for any signs of choking or aspiration before offering the next. Crushing all medications is not always safe or appropriate, as some medications are extended-release or enteric-coated and should not be crushed. Using a straw can increase the risk of aspiration by making it harder to control the liquid flow, and a supine position significantly increases the risk of aspiration. Always ensure the client is in an upright position and observe for successful swallowing. Question 16. A client undergoing chemotherapy reports severe nausea and vomiting. Which of the following nursing interventions is most appropriate? A. Instruct the client to eat 3 large meals a day. B. Administer an antiemetic medication as prescribed. C. Offer highly seasoned and fatty foods. D. Encourage strong-smelling foods to stimulate appetite. Answer B. Administer an antiemetic medication as prescribed. This question focuses on symptom management, specifically nausea and vomiting related to chemotherapy. The most appropriate and effective intervention for severe chemotherapy-induced nausea and vomiting is to administer an antiemetic medication as prescribed, as these drugs are specifically designed to block the signals that trigger nausea and vomiting. Encouraging 3 large meals, highly seasoned/fatty foods, or strong-smelling foods would likely worsen the nausea. Always prioritize pharmacological interventions to manage severe symptoms, followed by non-pharmacological comfort measures. Question 17. A nurse is caring for a newborn diagnosed with physiological jaundice. Which of the following interventions should the nurse anticipate? A. Prepare for a blood transfusion. B. Initiate phototherapy. C. Administer 4 fluids with glucose. D. Limit breastfeeding frequency. Answer B. Initiate phototherapy. This question assesses your knowledge of common newborn conditions and their management. Physiological jaundice in newborns is a common and usually benign condition caused by the breakdown of fetal red blood cells and immature liver function. Phototherapy is the standard treatment, as it uses light to convert unconjugated bilirubin in the skin into a more water-soluble form that can be excreted. A blood transfusion is typically reserved for severe cases of pathological jaundice, example hemolytic disease, for fluids may be used for hydration but not as primary treatment for jaundice itself, and limiting breastfeeding is generally discouraged as adequate feeding helps excrete bilirubin. Remember that phototherapy helps the baby's body excrete bilirubin more effectively. Question 18. A nurse is preparing to administer an intravenous, 4, push medication. Which of the following actions should the nurse perform first? A. Check for patency of the 4 site. B. Administer the medication slowly over 2 to 3 minutes. C. Document the medication administration. D. Educate the client about the medication. Answer A. Check for patency of the 4 site. This question tests your knowledge of safe 4 medication administration. Before administering any 4 push medication, the nurse must first check the patency of the 4 site by flushing it with saline to ensure the catheter is in the vein and not infiltrated or occluded. Administering medication into an infiltrated 4 can cause tissue damage or prevent the medication from reaching the bloodstream. Administering slowly, documenting, and educating the client are all important steps, but patency ensures the medication will be delivered effectively and safely. Always ensure the foresight is working properly before pushing any medication. Question 19. A nurse is providing care to a client diagnosed with obsessive-compulsive disorder, OCD. Which of the following behaviors would the nurse expect to observe? A. Social withdrawal and isolation. B. Recurrent intrusive thoughts and repetitive behaviors. C. Delusions of grandeur and paranoia. D. Periods of extreme elation followed by deep sadness. Answer: B. Recurrent intrusive thoughts and repetitive behaviors. This question assesses your understanding of mental health conditions, specifically obsessive-compulsive disorder, OCD. OCD is characterized by the presence of obsessions, which are recurrent and persistent thoughts, urges, or images that are intrusive and unwanted, and compulsions, which are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession or according to rules. Social withdrawal, delusions, and mood swings are characteristic of other mental health conditions, not typically OCD. Remember that the core of OCD involves the struggle between uncontrollable thoughts and the need to perform ritualistic actions to reduce anxiety. Question 20. A nurse is assessing a client with a history of heart failure. Which of the following findings would indicate fluid volume overload? A. Dry mucous membranes. B. Oliguria. C. Jugular vein distension, JVD. D. Tachycardia. Answer: C. Jugular vein distension, JVD. This question tests your ability to recognize signs of fluid volume overload, particularly in a client with heart failure. Jugular vein distension, JVD, is a classic sign of increased central venous pressure and fluid overload, indicating that the heart is struggling to pump effectively, leading to fluid backup in the venous system. Dry mucous membranes and tachycardia are more indicative of fluid volume deficit. Dehydration and oliguria, decreased urine output, could be a sign of poor renal perfusion, but JVD directly points to excessive fluid. Always check for JVD as a key indicator of fluid volume status in cardiac clients. Question 21. A nurse is reinforcing teaching about proper body mechanics with a client. Which of the following instructions should the nurse include? A. Bend at the waist when lifting objects. B. Use back muscles for lifting heavy items. C. Keep the object close to the body when lifting. D. Lift with a twisting motion to engage core muscles. Answer: C. Keep the object close to the body when lifting. This question assesses your knowledge of proper body mechanics for injury prevention. When lifting an object, it is essential to keep it close to the body to reduce the leverage and strain on the back muscles, allowing the stronger leg and thigh muscles to do the work. Bending at the waist, using back muscles for lifting, or twisting while lifting significantly increases the risk of back injury. Always advise clients to lift with their legs, keep the object close, and maintain a straight back to prevent musculoskeletal injuries. Question 22. A client is receiving intravenous fluids at a rapid rate. The nurse observes that the client is restless, has a persistent cough, and crackles are audible in the lungs. Which of the following actions should the nurse take first? A. Increase the fluid rate. B. Administer an antihistamine. C. Elevate the head of the bed. D. Document the findings and continue monitoring. Answer: C. Elevate the head of the bed. This question tests your ability to recognize and respond to signs of fluid overload, a potential complication of rapid fluid administration. The client's symptoms of restlessness, cough, and crackles strongly suggest fluid volume overload, specifically pulmonary edema. The immediate priority is to elevate the head of the bed, which helps to improve respiratory effort and reduce venous return to the heart, thereby easing the burden on the lungs. Increasing the fluid rate would worsen the condition, and antihistamine is inappropriate, and merely documenting without intervention delays critical care. Always prioritize immediate comfort and physiological support when clients show signs of respiratory distress due to fluid overload. Question 23. A nurse is planning care for a client who is NPO and scheduled for surgery. Which of the following interventions should the nurse include in the client's plan of care? A. Provide frequent oral hygiene. B. Offer small sips of water every hour. C. Allow clear liquids up to 2 hours before surgery. D. Encourage chewing gum to stimulate saliva production. Answer: A. Provide frequent oral hygiene. This question addresses preoperative care for clients who are NPO, nil per os, or nothing by mouth. Even though a client is NPO, they can still experience dry mouth and discomfort. Providing frequent oral hygiene, such as brushing teeth or using mouth swabs, keeps the mouth moist and comfortable without violating the NPO status. Offering sips of water or allowing clear liquids up to 2 hours before surgery would break the NPO status and increase aspiration risk, while chewing gum also stimulates gastric secretions. Always focus on comfort measures that adhere to NPO guidelines to ensure client safety before surgery. Question 24. A nurse is assessing a client with appendicitis. Which of the following findings would the nurse expect to observe? A. Rebound tenderness at McBurney's point. B. Right upper quadrant pain. C. Jaundice and dark urine. D. Absent bowel sounds. Answer: A. Rebound tenderness at McBurney's point. This question assesses your ability to identify classic signs of appendicitis. Rebound tenderness at McBurney's point, located in the right lower quadrant of the abdomen, is a hallmark sign of appendicitis, indicating peritoneal inflammation. Right upper quadrant pain is associated with conditions like gallbladder inflammation, and jaundice and dark urine are signs of liver or biliary issues. While bowel sounds can be diminished with inflammation, absent bowel sounds typically suggest paralytic ileus or obstruction, which are not the primary, expected findings for appendicitis. Always remember the specific location and type of pain associated with common abdominal conditions. Question 25. A nurse is teaching a client about a healthy diet to prevent cardiovascular disease. Which of the following foods should the nurse recommend the client limit? A. Whole grains. B. Lean protein. C. Saturated fats. D. Fresh fruits. Answer: C. Saturated fats. This question evaluates your knowledge of dietary recommendations for cardiovascular health. Saturated fats contribute to increased levels of low-density lipoprotein, LDL, cholesterol, often referred to as bad cholesterol, which can lead to plaque buildup in the arteries and increase the risk of cardiovascular disease. Therefore, clients should limit their intake of saturated fats found in foods like red meat, butter, and processed snacks. Whole grains, lean proteins, and fresh fruits are all beneficial and encouraged as part of a heart-healthy diet. Advise clients to choose healthy fats and limit saturated and trans fats to protect their heart.